Just to remind people, the session is recorded and will be available on our website. Just by way of introduction, I'm Jessica Berry and I am Head of Inequalities with the Population Health Team in the ICB. And this is part of our Population Health series. And Sinead, my colleague, will put a slide up about our Population Health Academy. So if you want to do that now, Sinead. So people can either take a photo of the QR code there, or you can join us via the web link, and we will put that in the chat. And there's just a short form at the end of the home page if you want to join our Population Health Academy. Okay, if you want to take that down, Sinead. Thank you. So if you can put your cameras on, that would be great. It's good to see faces. If you've got any questions as we go through the session, pop them in the chat, and myself and Sinead will keep looking at the chat and let Marina, who is joining us today, know if there's any questions. So I'm delighted to welcome Marina Davidson with us today, who is from Doctors of the World. She's an advocacy manager and is going to spend the next half an hour or so taking us through how you can become a safer surgery. So Marina, are you there and ready?
I'm here and ready to
go. Brilliant.
Thank you. Bear with me one sec. I will just share my screen. And let me know when you can see that, okay?
Yep, we can see that.
Perfect. I can't see everyone now, so shout out if something goes wrong throughout. So hi everyone, my name is Marina Davidson and I'm the Primary Care Advocacy Manager at Doctors of the World UK. So we're a charity that's part of an international network, but in the UK we operate independently, and I'll give a bit of an introduction to our work in a moment. I've unfortunately been caught out with this cold and flu that's going around, so excuse my slightly strange voice, but hopefully we'll get through it. So I'm just going to give a bit of an introduction to barriers to primary care and issues that people might experience when registering with the GP, and then give an introduction to our Safe Surgeries network, which is an initiative aiming to improve registration policies to make sure that they're accessible for everyone in your communities. So we'll talk about the importance of universal access to healthcare and some of the barriers that people might experience when accessing healthcare. We'll go through the NHS England guidance and entitlements to NHS primary care. We'll think about some examples of good practice to promote inclusive GP registration processes and further access to care. And then we'll think about the practical steps that you can take in your practice to become a safe surgery and implement the recommendations in your practice. So just a very brief introduction to the work of Doctors of the World UK. So we provide direct support to individuals through our CQC registered clinic and our national advice line, and that's for people with difficulty accessing mainstream NHS services. So most of the people that come to our clinic are not registered with a GP. They've often been living in the UK for years in most cases, but have experienced some kind of barrier to accessing mainstream care. Most of the people we support are people with insecure immigration status, so they might be undocumented or they might be seeking asylum. Often they have insecure housing status and are living in poverty. Oops. Every time I scroll, the slides go. So our service isn't a parallel to the NHS, so it's about supporting patients to access mainstream services in their local area. So we often refer to other services that support their health and well-being, but the main thing is making sure that people are registered with a GP in their local area for their long-term care. So Safe Surgeries is built on the evidence from our clinic, so on barriers to GP registration and the difficulties that our caseworkers and our patients experience in the registration process. So it's about a network of GP practices, reducing health inequalities and removing some of those barriers. We're also supported by a volunteer team of 35 experts by experience, so people with lived experience of health exclusion in some way of the UK immigration system, of the asylum system. So they're involved in our decision making, in producing resources as well, and delivering training on health entitlement to other community groups. Okay. So before we go on to the specifics on kind of primary care entitlement and access, just to think about why it's important that everyone can access healthcare. So firstly, it's a human right. So the UK is bound to give equal access to the right to health for all persons. It's also a core principle of the NHS. So in the NHS constitution, the NHS should be a comprehensive service available to all, with treatment based on clinical need and not ability to pay. Access to healthcare, and particularly access to primary care, is key for public health. So without good access to primary and community care and kind of early and preventative interventions, people are more likely to turn to acute services. There's also the health protection element of that. So the vaccination programs and screening programs that are delivered in primary care, for example, that if people aren't registered with the GP, they often don't have access to. From a health equity perspective, it promotes a fairer society, and then it's also cost effective. So there's a financial and a human cost of delayed access to care and these preventative interventions. So health inequalities and that delayed access to care costs money as well. Okay. So the social determinants of health are the conditions in which people are born, grow, live, work, and age. So factors such as education, physical environment, employment, and social support networks, as well as access to healthcare. And that significantly influences health outcomes and quality of life. The inequalities in health access and outcomes are linked to these social determinants of health. And migration and displacement are also considered social determinants of health. It's important to remember that everyone, no matter where they are from, has unique health needs, and ultimately that's what the health service is there to respond to. Asylum seekers, refugees, and other migrants that might be in vulnerable circumstances face similar health problems to the general UK population. So some have more complex health needs than others, like the general population. But there are some factors related to migration and people's experience that affect health needs and health access. So we'll talk about later about barriers to accessing services. People might have disrupted access to healthcare along that journey, or different, excuse me, or different access to healthcare as well in their country of origin. The circumstances of migration also affect health outcomes. So some people might be forced migrants, and that has significant health impacts, both mental and physical. Their life experiences prior to migration, so people might have experienced trauma, loss, abuse, neglect, both prior to migration or in their journey. And then circumstances in the UK. So particularly for people going through the asylum system, it can be quite difficult. It's a really uncertain time. And often people are without access to healthcare during that time, as well as dealing with the complexities of the asylum system as well. So just to give a brief overview of the definitions for immigration status. So although it's not relevant for primary care entitlement, it can be useful just to understand these terms. This is a bit of a simplification of those terms, but just to understand how that affects access to healthcare and how it affects people's circumstances. So these are just legal definitions, really. They're often temporary terms to describe someone's legal situation, and obviously don't define someone's identity. They're often quite fluid terms to describe what someone is going through. So an asylum seeker is someone who has left their country of origin and applied for asylum in another country, but their application has not yet been concluded. So in the UK, an asylum seeker would apply to the Home Office, so they're waiting for a decision from the Home Office on their asylum application. And that can be for quite a long period of time. And so in that time, people are in home office accommodation, which is quite basic and doesn't necessarily facilitate their access to healthcare. They're also not able to work and live quite a restricted life with limited financial support from the home office. Once someone has their asylum claim accepted, they become a refugee. So that's someone whose asylum application has been successful. The government recognises that they're unable to return to their country of origin owing to a well-founded fear of being persecuted. If someone has their asylum claim refused, they can appeal. But once all of their appeal rights have been exhausted, they become a refused asylum seeker. So their asylum application has been unsuccessful. In some cases, people might not be able to return to their home country because it might be unsafe. So they can either put in a fresh claim for asylum, or they might become undocumented, which puts them in quite vulnerable circumstances. And there's lots of reasons why people might become undocumented. So you can see that the definition is quite broad. So it's someone who enters or stays in the UK without the documents required under immigration regulations. So it could be someone who's had their asylum claim refused. It could be someone who has overstayed a visa or is a survivor of trafficking. But it means they're in quite difficult circumstances because they are unable to work, they're unable to rent a property. And yeah, as we'll see later, they're still able to register with the GP but might be charged for some hospital services. So we're just going to watch a short video from one of our experts by experience about some of the barriers to accessing primary care, and then we'll think about some of the responses to that afterwards. So please shout out if you can't hear or see the video, but I'll press play now and hopefully that will work.
Everyone, this is my story. My name is Ruth. Repeated rejection from space is from faces that are supposed to welcome you, that you know need you, will crush your hope and confidence. Registering with a GP as an asylum seeker is so difficult. My ID did not help either. The receptionist looked at me with disgust, asking for my passport, which I didn't have. How can I have a passport when I was trafficked? That was my question. Why would I even have an asylum ID if I have a passport? I remember them saying, we're never going to accept you. No GP in the area was helping me. I was battling with mental health and toothache. I started falling apart mentally. I was gone. When I finally got registered at another place, I was incredibly distrustful. I didn't trust anybody. I didn't trust the system as a whole. I expect to be rejected. It's fear that I carry in my body, and I still carry the fear to today. I was relieved to find a GP who finally took me on. Listen, I was able to refer me to another service. He was kind. He was really it was comfortable to talk to him. I lived in this area for 5 years. A few weeks ago was the first time I actually saw my GP, and I always bring a friend from church with me because I don't want to be rejected. At least when I'm rejected, I have somebody to kind of lean on. It took a lot. It took a lot for people like me to seek help. Health teams shouldn't turn someone away. They have come to you because something is wrong. No human being should walk in a health setting and feel like this. I am a national health advisor with Doctors of the World to change that.
Okay, hopefully that sound worked okay and gave us a bit of an introduction into some of the barriers that people might face when registering with the GP. Just a couple of questions here, I guess, to reflect on, and yeah, no pressure to answer them now, but just things that we'll be thinking about throughout the session. And if you have any immediate responses, feel free to put in the chat as well. So just to think about what consequences could the refusal of GP registration have for Ruth's health and well-being. what steps would ensure that people in similar situations to Ruth would feel welcomed and supported to access services? And this is something that we'll talk about throughout as well. Are there any examples of good practice from Ruth's story? And are there any challenges? So this is just something to think about as we go on. But if anyone's got any immediate thoughts, then feel free to share them in the chat as well. And unfortunately, that it's Ruth's experience is not necessarily uncommon. So there's been various mystery shopping exercises looking at registering patients without documents. So this one was from the Bureau of Investigative Journalism in 2021. They contacted around a third of GP practices in 10 locations across the UK and asked about registering a hypothetical patient who didn't have ID or proof of address. And most of the practices said that they wouldn't register the patient, so 62% and 14% were unsure. So only quite a small proportion of the practices in this survey would register someone without proof of ID, address or legal immigration status. And as we'll see in a minute, this conflicts with the NHS England guidance on this in terms of entitlement and what's needed to register. And we'll go through the key points in a moment. So this is just to summarise the main barriers to accessing healthcare, and Ruth, I think, mentioned a few in the video. So accessibility, so language barriers, literacy, digital and telephone, so people might not have access to a mobile phone or to the internet or phone credit to register online, to look at health information online and how to register. Lack of knowledge on navigating the NHS and entitlements, so people might not know what they're entitled to, especially if they're new to the UK and might not be familiar with the health service and how it works. People with insecure immigration status might be intimidated by questions about immigration status. They might be worried that their information will be shared with the Home Office and it has consequences for their immigration status, but that shouldn't happen in primary care anymore. But it's kind of a well-founded fear for people in that situation who might be distrustful of all services. Lack of ID and proof of address, as well as fear and previous experiences of judgment and prejudice, and lack of funds for suitable transport to attend appointments. So people going through the asylum system, for example, if they're in catered accommodation such as hotels, they receive £8-ish per week from the Home Office, which is kind of for everything. So that's not very much money at all. So it wouldn't allow for a bus ticket, for example, to get to an appointment. So often that can be a barrier for people. And then to think about who might not have proof of ID or address. So people going through the asylum system, as we heard from Ruth, might not have a passport or a photo ID, something with their name and address on it. Also people with no fixed address who are living in unstable accommodation or sofa surfing or street homeless. As I mentioned, people who are undocumented can't have a job, they can't rent a property. So having something with their name and address on it would be really difficult. Survivors of trafficking or modern slavery, people fleeing domestic abuse who might be staying with friends or family in a shelter, young people leaving care. So lots of different reasons why people might not have these proof of ID or address documents, but obviously not a reason to prevent them registering with a GP practice. And now just to quickly go through the NHS England guidance on this and some of the key points around entitlement. So this is available at this link here, so the Primary Medical Care Policy and Guidance Manual from NHS England. The main point here is that nationality and immigration status are not relevant to GP registration. So anyone in England can register and consult with a GP without charge, and that includes everyone, whether they're lawfully in the UK or not. So being ordinarily resident only applies for secondary care, so patients don't need to be ordinary resident to be eligible for primary care in England. And then documentation. So there's no regulatory requirement to prove ID, address, immigration status or an NHS number in order to register. So someone not having these documents would not be considered reasonable grounds to refuse to register patients or withhold appointments. So it's if someone doesn't have any documentation but they live within the practice boundary, then the registration should be accepted. And then for people who don't have a fixed address or might be afraid to share their address, an alternative address can be used. So a care of address, which can be the practice address or another address, such as a place of worship or a community centre. And at the point of registration, it's useful to have a way of contacting the patient if needed. So if they're collecting letters from the practice, or if they can receive any updates through a text message if they have a mobile phone, and we'll talk about that a bit more later. So that means then that there's very limited circumstances in which registration can be refused. So if the practice isn't taking on new patients and that's been agreed, or only accepting patients in the practice boundary or other exceptional circumstances. And then lastly, if there's any suspicion of fraud, so using a fake ID, for example, then the patient should still be registered and treated, but the matter should be handed over to the NHS Counter Fraud Authority. In some cases, a patient might not know how long they will be in the area. And the example in the guidance is people seeking asylum who are housed in Home Office initial accommodation, so such as hotels, for example. And that's because they are likely to be there for extended periods of time, even though a hotel and the kind of accommodation setup seems like it's fairly temporary. People are waiting for a decision for a long time and waiting in those types of accommodation. So where there is this uncertainty, but it's likely to be a longer period of time, then the guidance is that the patient should be registered as permanent patients. That means that it's better for their long-term care, so their medical records will be transferred with them if they move to another area. If they don't have an NHS number, it will also generate one at that point as well. And then finally, on access to registration, so there should be equitable access for all patients who wish to register. So it should be at all times in the day that the practice is open and every day. And also just a note on the paper form, so that accompanies the online NHS England service. So patients should be able to register both online and via the paper form, and that should be made clear as well. Okay, so Safe Surgeries is a network of GP practices across the UK. So you can see the practices signed up here. And it's about demonstrating adherence to NHS England guidance in order to tackle the barriers to healthcare faced by underserved communities. So being a safe surgery offers free training, resources and support, and we've got over 2,000 practices signed up at the moment. Some of the benefits of becoming a safe surgery are obviously complying with that NHS policy, being part of a supportive national network, so overcoming challenges with other practices and also sharing good practice. It supports staff learning and skills building, so it offers training for staff across the practice. It's CQC approved, so helps to demonstrate the equity and access framework, so making sure that everyone can access the care, support and treatment that they need when they need it. It improves efficiency and communication in the registration process. And then importantly, it improves patient experience and helps to meet the needs of your community. So the Safe Surgeries process starts with registering as a safe surgery, which is just a quick form on our website. And then there's 5 steps. So it's signing the Safe Surgeries declaration and nominating a practice lead, completing Safe Surgeries training and reviewing resources. So it's just a 1-hour e-learning course, which I'll share the link to later. Reviewing your practice registration policy and making sure it aligns with those recommendations, displaying posters in the practice and updating your website, and then engaging with the network and sharing any examples of good practice with us at Doctors of the World for the national network. All of the resources are available at this link here, and I've just highlighted a few here as well, and they're all kind of linked in these slides, which will be sent around afterwards. So the main guidance document is the Safe Surgeries Toolkit. We also have translated patient-facing posters, posters for the reception desk, a monthly newsletter, a template registration policy, which is here, and then some other resources as well, and they're all available on our website there. As I mentioned, the training is a 1-hour e-learning course. So it can be completed by anyone in the practice, and it's especially useful to include in induction as well for new staff. And it should take between about half an hour to an hour to complete, and covers kind of background and context, as well as some of the practical steps to become a safe surgery that we'll cover today. We also have some resources for PCN, so if you're involved in the management of your PCN. So a toolkit for PCN health inequalities leads, as well as this self-assessment tool as well. And they will be linked in the slides. So the 7 steps for safe registration are covered in the Safe Surgeries toolkit, so the main guidance document. And these are the kind of minimum requirements of being a safe surgery. So not insisting on proof of address documents, not insisting on proof of ID, never asking to see a visa or proof of immigration status, making sure that patients know that their personal information is safe and won't be shared with other authorities, using interpreters if needed, displaying posters to reassure patients that the surgery is a safe space, and empowering frontline staff with training and inclusive registration policy. And the e-learning course covers this in more detail, but just to come up a few of the tips for inclusive registration process. So if you do request documents, it should be kind of flexible and not a requirement. So all patients must be asked in the same way if you do request documents, but patients should be able to register without them. When registering patients who don't have a fixed address, using the full care of address, so not writing no fixed abode, and ensuring, as I mentioned earlier, that agreements are in place at the point of registration to maintain contact, so to ensure that patients are able to collect letters and test results. So also to be conscious of data sharing fears, so reassure patients that their information won't be shared without their consent, and also offer support for the registration process and promoting the option to use interpreting services both at reception and in consultations. To support with that, we also launched these patient questionnaires with NHS England. So for newly registered refugees and people seeking asylum, they're translated into 30 languages. So the translation is on the left and then the English version on the right, and they're all multiple choice questions, so they can, like, the answers can be easily transferred. So these can be shared with patients at registration, and then they can bring them back to their new patient checks or during initial health assessments as well, and have that information recorded. So that's particularly useful for patients without previous health records. So really, it's the registration, changing your registration policy that allows sustainable change across the practice. And we have templates for that as well. So including the training in the induction process for all staff and making sure that everyone is aware of Safe Surgeries registration, displaying posters for both staff and patients, and updating your website so patients know before they come into the practice about their right to register, and we've got resources to support with that as well. Finally, just a couple of extra things beyond registration to think about. So on language interpreting, so the main point here from the guidance is that patients should be able to access primary care services in a way that ensures their language and communication requirements do not prevent them receiving the same quality of healthcare as English-speaking patients. So that includes things like allocating double time for appointments, ensuring that interpreters are available at both reception and consultation, and always using professional interpreters, so avoiding using friends, family or children. And always promoting the option to use an interpreter as well for patients who might not know about their rights. And just also to highlight here that there's a language identification chart linked there so patients can share which language they need an interpreter for. And then finally, on help with health costs. So anyone, regardless of their immigration status, can apply for a HC2 certificate for free NHS prescriptions, dental treatment and site tests. Some people might not know that this support is available, so it's useful to keep copies of the HC1 form in the reception area. And if you've got any organisations locally who can support people to complete those forms, then that's really useful as well. And then the forms can be ordered in bulk. It's slightly different for people seeking asylum, and so sometimes they will get it automatically and sometimes not. So there's some further guidance on that there, and some further guidance in other languages as well in that link. And then finally, just to share some of our translated resources, which are useful to display alongside the kind of posters on registration. So we have lots of resources on navigating the NHS and right to healthcare. So this one, for example, is how the NHS works, a guide for migrants and refugees. So it's useful to have these available in different languages. So this is what another safe surgery practice has done. So printed out the posters in different languages and have got them available in waiting rooms. And we have a translated resources hub, which is available here. So there's different health topics as well covered there in different languages. And I think that is about it. So just a question, I guess, to reflect on is what steps can you take to ensure that all patients in your community can access healthcare? So considering changes that you can make individually and also across the practice. So that's just something to think about in the next few minutes. And again, feel free to put any answers in the chat. And then just to share some final links. So if you want to become a safe surgery, you can fill in the form on our website through this QR code. Everything is available on our website here, including the form and all of the resources and the training. If you've got any questions, happy to answer those now. But also the email address is there if anything comes up later on. And I think that is my last slide. I will leave this one on in case you want to note down the website. So yeah, happy to answer any questions now.
Thank you, Marina. There's a few bits in the chat. One was on prescriptions, but I think you've answered that. I think just to add that the pharmacists are usually quite helpful if someone presents with a prescription and what bit to tick at the back. If I remember rightly, there is a box that people can tick, and pharmacists are usually able to advise. Last thing we want is if people can't receive their prescribed medication. There's also something on. Do you monitor the safer surgeries, Marina, and are any of the
good question.
Findings published?
Yeah, very good question. So we kind of monitor where practices have got across those 5 steps. So there's a survey that we send out at 6 months of being a safe surgery, and also at 1 year if it's not completed at 6 months, which kind of gives us insight into what practices have implemented in the practice. So we kind of hold that data. In terms of like published stuff, there has been an evaluation done by UCL, I think last year or the year before, which I can share, which kind of interviewed staff in safe surgeries and in other practices and kind of looked at changes in practice and registration policies. So I can share that in the chat if that's helpful.
Yeah, that would be really good. I'd be certainly interested in seeing that UCL report. We had also a question from Lucy about what would be the best document to present to a surgery if they were refusing registration.
Sorry, I'm just reading the question. So is that from like within the practice or from a patient perspective?
I think
so
it's,
GP, what piece?
I don't know, Lucy, are you able to?
To support people signing up to a GP.
Yeah, I just was thinking because I work in probation, and this is a problem that people really face coming out of prison. I was thinking if the receptionist is kind of taking a firm stance that they need an address, what can the person provide? Kind of like I don't, this because it says here type thing.
Yeah, so from a patient perspective, we have on our website a GP access card, and I'll send the link in the chat in a minute once I stop sharing my screen, which is basically like a yellow card. There used to be physical ones, but we can't get hold of the physical ones anymore. It was like an NHS England campaign, and it says, I have the right to register, I don't need proof of ID or address, and then it has a number on the back for the NHS England kind of customer contact centre if people have like difficulties with registration. So yeah, that card is useful. I guess if you're advocating on behalf of a patient, then like the NHS England guidance is always useful to kind of quote from. And also just to note as well that our clinic and advice line is available across the UK to support people to register with a GP if you know of anyone who's having particular difficulties. I'll put all those links in the chat now.
Thank you, Marina. I do know that I think we managed to get some yellow cards that probation are using somewhere. But like we say, you can just refer to an electronic version of the yellow card, or just quote the guidance. And of course, if you do have any problems or difficulties as an organisation supporting vulnerable people, do get in contact with the ICB or me personally, Jessica Berry, nhs.net. So I'd be happy to help if you do experience any problems. I think on the whole, it's in the GP contract that people don't need a proof of address, so that should be coming through, but I certainly would be interested if people are having difficulties. We've also got some resources that we'll put on our Population Health Academy. Sinead, did you want to share? And I'll whiz through them resources that you can look at your leisure. Here we go. So, yep, if you go forward. So we've got some guidance around Afghan nationals around mental health, and that was produced by Hampshire County Council. Move on. We've got several different guides to using a GP service. I expect they're from Doctors of the World, those ones. And move on. We've also got some other asylum seeker health resources there by the BMA. And move on. I will whiz through quickly because there is 20 slides. Now this is quite important. I'm not sure if it comes in different languages, but it's definitely a good resource for maternity care for asylum support. So definitely give to your members of staff that are dealing with maternity issues. Move on. Immunisation in different languages, and on again. Again, if you've got social prescribers in your PCN, it would be worth sharing this with them. Another useful toolkit. Not sure again if it comes in different languages, but this is actually the resource kit for the social prescriber. So that would be useful to share and move on. Okay, what's this? This is another bit of guidance. And if we move on again, I'll just get to the bit which we've got some training. If we flick through the training, people can read that at their leisure. There's several bits of training. We think we've picked the bits that are free. This might be more relevant to you locally. It's services in the area. So we've got a national charity here. Whereabouts is the? I think that's a national charity for the south, throughout the south of England. You've got Friends Without Borders for those of you who are in Portsmouth. And move on. We've got a rural refugee network. Again, is that to support family, young people and places across Hampshire. So that is a local one. You've got the areas at the bottom there. Southampton, you've got Southampton Action. And move on. I think that might be it. Oh no, we've got some more. We've got Winchester and Southampton groups there. And Winchester City of Sanctuary as well. So we've got quite a bit in Winchester, and a Portsmouth City of Sanctuary as well. So you have got physical places or communities, virtual communities that you can either liaise with yourselves if you wanted to get further information, or they may well be able to support individuals that you're supporting that are from these groups. So we've got a couple of minutes left. If anyone has got any questions, if they want to raise their hand or put it in the chat. No, okay. Well, we've got a couple of minutes left, then we have got a very, very short evaluation poll form for people to complete, and Sinead will put that up on the screen now. There you go. It's really easy. It's just a couple of a few questions that'll take less than a minute, so that'll be really helpful from today's session. Excellent. So why people are completing that. Thank you for all those who have joined. It's really good to see that people have got an interest in registering their surgery with Safer Surgeries. If you do register, it would be great to know if you could pop me an email just to say, yes, we've registered and this is what we're doing. I am going to pop my email address in the chat. There we go. Yeah, so please do let me know if you do register as a Safer Surgery, and we may well come back to you to share any good practice. So, Marina, did you have anything to add?
No, I was just answering a question in the chat, but that I think maybe it's better for me to just speak. So there was a question around building trust with patients who might have been hesitant to register at a GP and speak to a GP about health concerns, given the barriers we've spoken about. I guess the main thing is kind of making sure that it's the same GP every time, so people aren't having to kind of retell their story every time. Making sure that there's an interpreter as well available, and that kind of checking that the interpreter is like well understood, like it's the correct dialect, things like that. But yeah, I guess there's not really an easy answer to that question. There's lots of things I guess to consider, and there's no easy solution, but yeah, a couple of things just to start with. But otherwise, no, I think that's all the questions. So thanks for having me.
Thank you ever so much. And just to let you know, and those that are members of the Population Health Academy, we will be having a communities of practice session on migrant health, where we'll have speakers, including experts by experience, and we will be advertising that soon. And Marina's also put her email in the chat. So thank you. Any questions, please do email me, and thank you for attending. Hope to see you again. Bye.